Estás viendo Canal América, televisión dominicana para el mundo.
A Time for Truth show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for Truth show. It's a pleasure to have you back with us. I'm your host, Dr. Bernard Fialkoff. And first we'll get to a little housekeeping. Many of you have been asked, how do I avail myself of all the previous episodes of the last 6 years? It's very simple. Go on YouTube, click on A Time for Truth show. Hit the subscribe button. There's no fee. There are no qualifications. The only requirement is that you help us bring integrity, honesty, and truth to the world so we can live a future that's happy, flourishing, and prospering. Isn't that what we all want? I think so. So tonight I'm going to share with you some information and some technology so you can have a confident, pleasing, comfortable smile. Because so much of our time is spent utilizing what in dentistry we call the oral cavity, the teeth, the smile, the chewing, the speaking. There's so much that goes on in the oral cavity and with teeth, with gums, that when we lose parts of that apparatus, it's a loss to us. It's difficult and it's embarrassing. In fact, it's one of the reasons people don't come to the dentist more frequently. Aside from the fear, aside from the money, aside from the time issues, it's the embarrassment and the fact that we don't want to look foolish. So let's put up the first image and let's start taking a look at what we can do. What are the steps? What are the possibilities? And how do we recognize what's going on in our mouths? How to restore the smile that we envision. That's beautiful, cosmetic, it's comfortable. So you can chew without pain, without sensitivity, have a pleasing look when you smile in front of people, or you're taking pictures at a wedding, or going out with your significant other. Restoring smiles, which I, as a periodontal and dental implant surgeon in Metro New York, have done now since, I can't believe how many years, 1982. In Bayside, New York, and been going ever since. So there you see actually one of our patients who was a younger woman, lost a tooth, had some orthodontics, and you look at the picture and you say, well, I can't see her implant, but she has an implant. It's an upper lateral incisor implant, and she was a beautiful young girl. But imagine her with a black space or with a removable denture. It would have been horrible. So let's see what we can do to restore our mouths the way we'd like it to be. Let's go to the next image. And let's take a look at some interesting facts, because about half of American adults over the age of 30 have some form of gum disease. Gum disease, which is called periodontal disease, causes bone loss, and thereby you lose your teeth. And when you lose your teeth, either you're going to end up with dentures and lose more teeth, or you're going to go to dental implants to preserve what God gave you. And about 70% of Americans who are over the age of 65 have some form of periodontal disease. That's quite amazing, because our population has gotten older, and so over 65 is a tremendous number of people. You're talking about 60 million Americans with some form of periodontal disease. And 23% of Americans, with about 75 million, have some recession, have some unsightly teeth, some very sensitive teeth, very uncomfortable. I get many patients come to my office and say, "Oh my God, what's wrong? I can't chew on the side. I'm so sensitive." People end up with root canal. Some end up with dental decay. The decay goes deeper. They lose the teeth. It's not something that you want. Let's go to the next image. Now, there on the upper right, you see a denture. Nobody wants that, because at nighttime you have to take it out, leave it in a glass. You feel very uncomfortable with your partner, or even if you're with yourself at home alone, you feel very, anxious or sad because you've had a loss. And that's why there's been such a demand for implants. On the bottom, you see some cases that I've done with the implants on the x-ray and with the images in the mouth. And you look and you go, well, where are the implants? That's the beauty of a dental implant in 2026. They function and they are just like your own teeth. Let's go to the next picture, please. And in this image, why do people avoid the dentist? What is it? Why don't they just go, save money, not lose teeth, so that you don't need implants, so that you don't need special gum surgery, and you can smile? Well, the first and most important is fear and anxiety. Fear and anxiety because dentistry has changed tremendously, but unfortunately, there are some who are out there who have still experienced it, and unfortunately also there are some offices. You could call them offices, I would call them clinics, and they're really not the way dentistry should be practiced, and dentistry should be in a calm environment. Our local anesthetics today numb the patient. There's no reason for the patient to have pain, or if they do, very, very little, very momentary, until we give them some Novocaine again, and then there is no more pain. But unfortunately, many people avoid the dentist because of fear or anxiety. What's the next most is cost. Well, my insurance doesn't cover it. Or, well, I have a lot of bills. One of the things I always try to get across to people, sometimes we take better care of our cars, which last about 10 years, than we do of ourselves. And we buy or lease cars what are, at the very least, if you buy a very inexpensive car, it's going to be about $30,000. And your lease is going to be based on it, even if you're leasing it. So you lease it over 10 years, or you lease it over 6 years. But we won't do that for our own mouths when the treatment that you could get would last you much longer than what we're keeping our own cars. So I try to sometimes wake people up to, what are you saving for? Because if it's not for you yourself, what is the benefit of saving? And, sometimes there's a time constraint with work, and that's just a matter of priorities. Because I always tell people, if your daughter broke her leg, would you say you don't have time? No, you would take off from work like that. You would drive her to the hospital, get your wife, or your wife would get you, and you would help your daughter with her broken leg, or your son. So really, I think time is a matter of priority. We talked about, the embarrassment, self-consciousness. That's another big one. But how are you going to fix your embarrassment if you don't go? And then sometimes they say inconvenience, but I think at that point now, we're really getting far afield. Because if it's inconvenient to help yourself get better, I really think the game has been lost already. So let's go to the next image, please, engineer. And what do we do here? This is a person who thought it was inconvenient, it cost too much, or, they were afraid. So now they get like this. And what is the benefit? There is none, obviously. But what is their road back? Is there a road back? What can they do with this? When you look at the lower right x-ray, you see the bone loss in black. When you look at the lower left image, you see all this tremendous recession. That person's teeth are very exposed. They're going to be very sensitive to cold, to sweet. The upper left is horrific with tremendous tartar deposits, teeth that are just about falling out of the mouth. And on the upper right, more of the same. Let's go to the next picture. So what do you do now? You just resign? Is it time to say, well, I'm an old person, I guess I can retire, put me out to pasture? No, I don't think so. There are many things we can do, and if you look at this one case here, it shows you that on that upper image, the lower image is the same person, but what's happened? That person had a tooth that had severe gum, or what's called periodontal disease. It got exposed. Now the person was very unhappy, the tooth loosened. But what we did is we deliberately, what's called extruded the tooth, was bring it down out of the bone. Because when we do that, that brings the gum down with it. And that's why on the bottom picture, the bottom x-ray, you see that somehow we grew the bone back. Well, we don't always have to do a bone graft. In this case, we actually slowly pulled the tooth down with the help of an orthodontist and position that person's new tooth the way you see it. It's a miracle. Let's go to the next image, please. And here you see that with implants, you have another chance. On the right, you see the implant, which is a substitute root. That ball that you see that's white is the cap or the crown. And they usually have metal. So the metal is covered by porcelain. And it looks like that white that you see on the x-ray. On the left, you see it in the mouth, and you go, well, I don't see anything. That's right. Most of the time, or really much of the time, or all of the time, you don't really see that you have an implant. It looks like a tooth. Only in the really severe cases where the person's let it go is it become a little more apparent, but you're still lucky. You don't have to have a denture anymore. You have teeth. You can chew naturally. They don't fall out of your mouth. You don't take them out at night. Let's go to the next image. So, how do we avail ourselves of this? Well, the first thing we do in the office, we take a CAT scan, we take models, we get charting, examinations, because you need to do a proper diagnosis. Let's go to the next image, please. And there you see the scan. And there you can see how we can see the bone thickness, the anatomy, where are the spots we need to avoid. In red, you see the facsimile or the possible implants that we can place, so that before we even touch you in the office, we already have a plan of what's possible and what can be done in a safe manner and what's going to last you, because we see in 3 dimensions. And so we plan properly. When it's not possible, we do bone grafting. Let's go to the next image, please. And here is another scan. And the feature of the scan that we have is we can do imaging. And by imaging, we can actually place implants as facsimiles to see and plan the case. What you see there in blue and yellow and purple are the different size implants feasible, and how we plan them out to make that person's new bridge so that they will be able to have teeth. And so we know before we ever touch the person that it's actually possible. Let's go to the next image. Now, this is something probably you say, well, geez, I've got that. It's impossible to fix, right? And what is that x-ray on the bottom? I never saw them in my dentist office. Well, of course, because those are scanned three-dimensional x-rays. Usually only the specialists will have those. Some general dentists have them nowadays, but we have it in our office because we deal with this constantly. And so we take a three-dimensional picture and we see that this person has this severe recession because it's really not a gum problem, it's a bony problem. And that person should have had braces early on. So it's important to realize that in these cases is that to learn so that maybe if you can, it's too late for you, that at least your son and your daughter or your grandchildren can benefit from this technology so they can avoid that severe recession. Let's go to the next image and I'll show you a miracle. Today in dentistry we do miracles. This is the same person. You say, no, it's impossible. That's Photoshop. That's, some kind of program. No, it's not a program. That's actually what we did with a gum graft that you can see there. You see the outline of it. And it healed beautifully. She's a very young woman, very distraught. At first we thought we were going to have to take the tooth out and do bone grafting, but she demanded I try to do her a soft tissue graft, a gum graft, which we did, and you can see the miracle of the result that we were able to generate. Let's go to the next image. So what do we do with this? What if you're one of these people and maybe you didn't have good insurance, or you were petrified and you didn't want to do the implant, or you had to go to the army and you had no time, or your parents didn't want you to have bridge work, or they couldn't afford, or you couldn't afford. And so what happens, you end up with these plastic removable teeth. Some have wires, some expand and contract like you see on the bottom. All different types of dentures that the people wear. None of these are really what you want, because now you have something in your mouth. You have to take it out at night. It harms the other teeth, causes the other gums to recede. So what do? Let's go to the next image. And what do we do with this? Well, you have a receded tooth. Now the crown is exposed. You have a dark metal margin. The gum is receded. And if your smile line is high, this is going to be visible. You're going to be very unhappy. What do? Let's go to the next image. So what you do is, let's go in sequence, a step at a time. First, let me explain to you so you can understand what is a dental implant. Well, a dental implant, which you see on the bottom, surrounded by the brown, which is the alveolar bone, the bone. A dental implant is a substitute root made of titanium, and that implant anchors solidly in the bone, and after it heals, the dentist will put on what's called an abutment and then a crown. And the abutment goes into the implant, screws in, and then the crown gets cemented over it. So there is your dental implant. Let's go to the next image, engineer. So in our office, the first thing that happens is we do the exam, we take the radiographs, we take the models, we consult with your general dentist or your specialist, which is called a prosthodontist, and we confer with the orthodontist, sometimes the endodontist, sometimes the oral surgeon. It's really a team effort, and we come up with a plan for you. Let's go to the next slide. And we treat the gum disease, as you see on the top. And when we do that, we clean up the tartar deposits, we take out the hopeless teeth, we do bone grafting. Once the bone is healed, we place the implants. Once we place the implants, We start fabricating the teeth with your general dentist, with your prosthodontist. And then on the bottom, the reality. You have your teeth again, your third set of teeth. They feel like your teeth. You brush them like your teeth. They smile like your teeth. It's really a miracle. Let's go to the next image, please. Here's a patient that we treated. She had many dental implants at our office. She was very happy. When she came in, she was missing about 4 different teeth. And if you were to take a look, you'd be hard-pressed to really know which is her real tooth, which are the implant teeth. Let's go to the next image. Here's another one. This is a very pretty young woman. She's about 16, and she was born without her lateral incisor. So we actually placed her lateral incisor, and she was extremely happy. And you can see, you really can't tell. It's not the central incisors, which are very long. Those are her natural teeth. And so you would be hard-pressed to know, because there's only one, but the 2 lateral incisors look exactly the same. Let's go to the next picture. And this we talked about already, so let's go to the next picture. So it's important to actually understand what is going on. So let's go to the next image, please, engineer. Because what you do is really going to affect what's going to be happening. And engineer, you have a video there. You let me know when you have it ready, because there's a video that I'd like to have us play that goes. So if you're ready, you can go ahead and play the video that goes with this presentation. And so the viewers can have this. And because what happens today is going to affect your future. That's a quote from Gandhi. The future depends on what you do today. So we're going to show you the video, engineer, and put that video on, please, for us, okay? Here we go. No one wants to go around with dentures, with teeth that are loose, with plastic in your palate because they're taste buds on the palate. What happens when you put something artificial to hold plastic teeth? You lose the sensation of taste and of heat. You can burn yourself because you're not aware of the heat. What's called proprioception, the nerves in the area are very important for sensations. And we're missing that when we have these plastic teeth. Aside from the fact that taking them out at nighttime with your special person around you, your partner, is not really a fun thing to do. So let's take a look, because what do I see in the office? Many times I see patients disappear. They come, they get an exam, and they find out what's wrong, but then they just turn it all over to the insurance. And when you do anything like that in life, where you really exert no control over where you're going, it doesn't usually end up very well. In our office, we try to help all our patients to maximize their insurance coverage, but when you have a case that you ended up with dentures like I've shown you, and missing teeth, and spaces and gaps, your insurance is not going to cover all of what you need. So then what you really have to take a look at, is that the way you're going to progress? Because if it is, the reality is you're going to lose more and more teeth each year. What's happened is you've lost so much of your support that what's left is not sufficient to hold the pressure of the bite. And just like an office full of workers that started out with 30 workers, because the mouth has 32 teeth, but the boss now has cut it down to 20. 20 people seems like a lot of people in an office, but if originally they were 32, you've cut out about a third of those people. The office is going to be stressed. So what happens is your teeth get stressed, they break, or the fillings break, or they crack totally, in which case they cause pain. And now we're dealing with taking it out and doing something called an immediate implant, where we have to put a tooth in to replace the missing tooth. Sometimes we do that immediately and put a temporary tooth in the area immediately while the implant is healing. But that could have all been avoided if we had actually developed a plan that was feasible, that wasn't a great economic hardship, that was going to get you out of embarrassment and discomfort, keep you out of dentures, and give you your smile back, give you your confidence back. If you look at how much is available in today's world, really I think that we should apply it to ourselves first. Sometimes we spend too much for everything else around us, and it's almost as if we're the last thing that we take care of. And when you think about the fact that everywhere you go and you're speaking to people and you're smiling, you want to have that confidence in your space. It makes a difference between meeting and having that significant other, getting and keeping a really worthwhile job or position, and being comfortable at community events, at social events, at weddings. So what I can tell you after 44 years of periodontal and dental implant treatment, come every 3 months for a simple cleaning, or see your dentist every 3 months for simple cleaning, or alternate between the offices, which is the best of all worlds, because your dentist is checking you for what he is an expert at, we're checking you for what we're expert at, and you keep your mouth healthy. Floss every night, avoid sugar, definitely avoid smoking, because smoking causes 3 times more disease, everything else taking exactly the same. Avoid drugs, because they are very harmful with many toxicities. And exercise. Get sufficient sleep. Eat a balanced diet. And avoid stressing yourself out. Try to surround yourself with pleasant people. I know when you come in our office, you'll be very surprised. We create a calm environment. We try to make it stress-free as possible. And with your dentist, we'll help you get that confident smile that you've always wanted. In the next episode, we'll do part 2 of restoring your mouth in today's dentistry. Thank you so much.
This show was sponsored by Atimefortruthfoundation Incorporated as a community service.
Sometimes life can be so damn hard, you don't know where to go. Everything keeps falling apart, yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your feet